You're most welcome. It's Sunday, the 17th of January. Few countries in the world to look at this morning. Is there signs of hope in the United States with reducing cases? It's starting to look like that. But I'm really concerned about this new variant taking hold there, because we're in a kind of similar position in the United States to what we were in the UK around about the end of November, beginning of December, where things were more or less under control and numbers even going down. Then we were hit by this new, more transmissible variant. So a bit concerned for the States, but the immediate signs are looking slightly more promising. I wouldn't say it's looking good by any means. Long way to go, still a lot of difficulties. Cases down in the UK for sure. So the strategy that we've implemented, this lockdown strategy in all four countries, we weren't sure if this was going to be enough for the new variant, but it's looking like it is. But it's a difficult strategy. And we'll look at a few other countries as well, some fascinating lessons to learn from around the world. Israel and Zimbabwe come to mind that we might look at later on. Now, let's start off straight away with some detail. Now, let's go to this from the States first of all. And we definitely see a downward trend here in the States in the 7-day moving average. So definite slight downward trend. That is encouraging. Now, unfortunately, deaths, of course, are going to lag behind. So death rates still pretty high. But that is, it's looking better than it was anyway for the United States. That is for sure. In terms of new cases. Now, broader picture first of all. Mr. Biden comes into office in 3 days' time, and he's promised 100. Well, promised. He's very, very hopeful, and I agree, because he gives a good rationale for this, that he can deliver 100 million shots of the vaccine in his first 100 days in office. So if you're not familiar with the way the States works, which I'm not particularly, but the president's first 100 days is always considered to be the key indicator time. So one of the things he wants to be judged by after 100 days in office is, have 100 million American vaccine shots been given? So a noble target indeed. Currently there's supply issues, according to some news outlets. Using the Defence Product Act, so that should probably be capital letters, the Defence Production Act. So the Defence Production Act, as I understand this, basically you can say to that factory, right, you're doing that now, and they have to do it. This is a wartime footing that is going to be using the Defence Production Act. It's also going to be using the Federal Emergency Management Agency, FEMA, and the National Guard to build sites. So he's pulling out all the stops here. This is literally a wartime footing. And of course, this is exactly what is required. So this is encouraging from the States. And he's also going to issue a federal mask mandate, we believe, by executive order as one of the first orders of business as soon as he comes into office. And we would imagine that this is saying that masks must be worn in all indoor public areas throughout the United States. So encouraging. Some data there. Now I'm going to be talking about this one. I've been using data from this site from the Atlantic for some time, but it does seem to be, I'm not quite convinced by that one at the moment. I'm going to give it a few days to check. I'll tell you what I mean in a minute. So cases in the United States, 215,000 in 24 hours, so over 24 million cases now essentially. Now the reason I was just highlighting that is this Atlantic site actually says cases are up about, I can't remember, a few percent, maybe about 8% in 7 days. Now I'm hoping that's just out of date, because it looks like they're down 8.1% in the past 7 days, according to other data sets. So cases in the United States, and that would certainly be indicated by the official CDC data, looking like it's down a bit. Hopefully that website's just out of date. If it's not updated soon, I'm going to scrub it and get my data from other sources. We always have to go with the accurate evidence as far as we can get it. And all of these links that you see written down here, of course, they're in the description. So just click on them; they'll take you straight to the site. At least they should do. National positivity rate still very high. I mean, the epidemic threshold is 5%. It's 11.1%. So that is still indicating a lot of community transmission in the States. Hospitalizations actually down very slightly in the past 7 days, down 3.5%, but still at a basically unmanageable level. That's the number in intensive care. That's the number ventilated. So still huge numbers of people in the United States. Some areas struggling massively, other areas not so bad. But the overall trend there is down slightly, again encouraging. Deaths, as we would expect because of the longer delay, continue to rise from the previous increase in cases. So the deaths that we're suffering now, people that are infected back here. So the deaths may well carry on increasing for another week or so, unfortunately, in the United States. So up 6.4%. So we see this kind of trend that we've come to expect now when cases are declining, that the hospitalizations and the deaths will go down more slowly. Now, US vaccination program, Moderna and Pfizer, of course. Now, there's a big hoo-ha going on in the States at the moment because basically not enough people are being vaccinated quickly enough. It's going far, far, far slower than anticipated. We had expected 20 million vaccinations to be actually given by the end of the year. We're still nowhere near that. And there's a bit of a to and froing between central government and state governments as to who is causing the delay. Now, good to see on the news that very big centres opening up now in the States. It is starting, and once the United States gets going, its momentum will be immense. It is going to get this done. It's just been a bit of a slow start, especially with these extra powers that Mr. Biden's taking. Things will happen. Don't ever underestimate the industrial and organisational might of the United States once they get their act together. But according to my data here, that's the number. 31 million have been distributed, but only 10.5 million have had the first dose and 1.6 million have had the second dose. So it looks to me like this delay is more at a local level. Now, that's based on very simplistic interpretation of that data, of course, but I suppose it doesn't matter really. We don't want to attribute blame. We just want to get it done. We want this job done and dusted. United Kingdom. Sir Simon Stevens, head of the NHS. Now, this is serious. Hospitals are currently under extreme pressure. London, South East, East of England, Midlands, North West, where I live, particularly badly affected, largely as a result of increased cases from the new variant. And there have been transfers around the country. For example, patients were transferred from London intensive care units up to Nottingham, I believe it was, because they simply couldn't cope in London. So transfers are happening. The busiest time for the NHS is going to be the next few weeks. The next few weeks are absolutely pivotal. Cases are coming down. Hospitalizations are still unsustainable because of this delay effect. Now, let's just look at the COVID symptom tracker app for encouragement. Now, this is actually, I think, the most up-to-date data in the UK because it's done by people live reporting every day. So 43,000 new cases, down quite a bit. And when we look at the prevalence, well, look at that. I mean, it's unmistakable, isn't it? The prevalence there on the 17th of January is heading down. Now, this is still a massively high level. There's still 750,000 people currently infected as we speak in the UK, but the trend is looking more favourable. So really quite a relief to see that starting to go down now. These were frightening days when we considered the implications of this level of increase. So this is the effect of the new lockdown measures in the 4 countries, and we see that they are working, and it is a real relief that they are working despite the more transmissible strain that is now so prevalent, indeed ubiquitous throughout the country, and most prevalent strain in many areas now. So estimated R number in the UK, it's been firmed up a bit by the 15th of January. It's now between 1.1 and 1.2. The previous estimates, we said it was between 1 and 1.4, but the data's been more finely looked at now, more finally adjudicated, and that is the figure as of the 15th of January. 2 days later, and we hopefully that tide has now been turned. I'm hopeful now it's about 1, but of course the data is always slightly delayed. In fact, I'm hopeful it's slightly below 1, given the picture on that graph there, going down slightly. And let's just confirm this actually with the official data. Always good to compare and contrast your data sources in case one's gone a bit cockeyed. If I can get the right screen, there we go. And again, on the official data, cases by date reported, we see this drop off and also on cases by specimen date, we see a drop off. So the two main data sources that I've found reliable over the last, dear me, it's nearly a year now, in the UK, but both agreeing with this trend. So we'll accept it. Daily growth of infections between 2 and 5%. Again, well tied down data here, well tied down between 2 and 5%. On the 15th, hopefully that is now 0 or even negative. Cases yesterday, last 24 hours, 41,000 in the UK. Total number of diagnosed cases. Cases in the last 7 days, officially now, with live data as of the 17th, down 18.6%. It's quite a relief, isn't it? It really is. But of course, it's not over for the hospitalizations and deaths by any means. By any means. So looking at that, hospitalizations, another 4,500 per day at the moment, 37,000 people in hospital. That's the number on ventilators. Not sustainable. So cases down, but last 7 days hospitalizations up. Last 7 days, that was the number of deaths in 7 days, 7,772. That is deaths within 28 days of a positive test. Over the past 7 days, an average of over 1,000 a day. It's grim stuff indeed. Total number of deaths within 28 days of a positive test diagnosis. So like hospital admissions, deaths are up 23.5%. And will continue to go up for another week or two, I'm afraid. Because of the trend in cases, this is inevitable. That's the deaths on death certificates. So this is a probably more accurate figure. Now it's estimated that 90% of the deaths on these death certificates were actually directly attributable to COVID-19, directly attributable to. Vaccines, first dose, 3.5 million as of the 15th of January. Second dose, we want this number to remain fairly low, actually. It's this number we want to go up at the moment because of the emergency nature of the situation we're in. Now, and there is evidence. So I get criticised for this. You know, people say you're supposed to follow the evidence, and now you're saying just give 1 dose of the vaccine first. Well, we do have evidence. And we've looked at this numerous times, that the hospitalisation rates plummet after the first vaccine. They go down dramatically after the first dose. And we've given evidence for that. So the evidence that immunity is high is not as convincing. We're going to look at a couple of figures on that later. But the evidence that hospitalisations goes down is there. So I believe that the government is evidence-based in this instance, and that the strategy of giving the first dose of the vaccine is evidence-based. Next step in vaccination. Government say by the end of June, all over 18s, 54 million people should be vaccinated. Wow, this would just be, well, it would be the biggest vaccination programme, certainly in the country and in the world. Although others are going to be competing with it, as we'll see, in terms of global vaccinations. That means 45 million people a week within the next month or two. This is going to be stepped up. So I think this will happen. So I think what we're going to see is cases increasing, not vaccines, sorry, let me get this right. What we're going to see is vaccinations increasing gradually, increasing, then go up quite dramatically as much more infrastructure is put in place. So I do expect to see an accelerated growth of the vaccination programme. We've ordered an extra 17 million Moderna. Now the number of Moderna vaccines in the UK is currently 0. It hasn't arrived yet, but it is approved. Johnson & Johnson expecting data from Johnson & Johnson pretty soon now. UK has ordered 30 million, so that the final phase 3 data should be out, I'm hoping, within days to a week or two, so that's encouraging. Nadam Zahawi, the vaccination minister, new vaccines for variants 30 to 40 days after first identified. So this is Nadam Zahawi, Minister for Vaccinations, and he said that if there is a new variant of concern that's causing problems, then the scientific capacity in the UK can produce a vaccine to match and counter the new variant within 30 to 40 days. And we know that work is being done at Oxford on this at the moment. So that is encouraging. So even if the current vaccines aren't working against all mutations, the South Africa, the UK and the Brazilian mutation, notice we seem to have gone back to naming viruses after the place where they originated. There's debate about that at the moment. But what he's saying is, the serious point is, Nadeem Sahawi, the South Africa variant, the Brazil variant and the UK variant, even if it turns out that our vaccines aren't going to be effective at the moment, which I suspect they will be, but even if they're not, it can be adapted quickly. So that is very good to hear. Hospitalizations and deaths are going to go down in early March, so we've got the rest of January and February to get through, and it's going to be the hardest time that the National Health Service has ever had, unquestionably, in the next weeks. Not minimising the severity and the emergency of that. But going ahead with good news, the UK has made a super vaccine factory. Now, it's cost £158 million. Now, compared to what other things are costing on this pandemic, that is absolute peanuts. £158 million to build this new super vaccine capacity factory. When this super factory is up and running, a new variant of concern, if it's identified, they can produce enough vaccines in 4 months to vaccinate every human being in the United Kingdom in this one facility alone. This is incredible. They don't say on the literature, but I'm sure it's going to be the biggest vaccine producing unit in the world by a country mile, I would have thought. Opens later this year. Now, this vaccine super factory was actually first planned in 2018. 2018 it was first planned to open in 2022. But the government have chucked a load of money at it and they brought it forward by a year. Rightly so, of course. So in a sense, this pandemic occurred 1 year too early for the UK. Had it been a year later, we would have been in a position to mass produce vaccines much, much quicker. But this super factory could potentially save untold lives, because it's going to be exporting it as well, presumably once the UK has been fully vaccinated. They won't say, well, that's it, let's go home now. They'll carry on and export it, I would hope, and producing vaccines at very low cost. And also it means when the next pandemic comes along, and I chose my words carefully there, I didn't say if, I said when the next pandemic comes along, and it is a when. When the next pandemic comes along, they'll be in a position to make vaccines much quicker. And everywhere in the world needs to do this, because the next pandemic, as we've said many times before, could be 10 times more transmissible than this one, like measles. It could be 20, 30 times more deadly than this one, like Middle East respiratory syndrome or Ebola. We've been lucky this time. And the human race really needs this safety line from massive vaccine producing capacity, locally all around the world, and this is going to be the UK one. So Vaccine Manufacturing Innovation Centre is called, and it's run under the auspices of Harwell Science and Innovation Campus in Oxfordshire, not-for-profit company, good to see, established by the government as far as I know, capable of producing 70 million doses in 4 to 5 months. Just wow. Marvellous. Brilliant. Much of the Pfizer and Oxford vaccine made in Belgium and the Netherlands at the moment, so we are having supply issues at the moment. But this new facility can produce all sorts of vaccines in all sorts of mega fermenters. It can produce the mRNA vaccines like the Pfizer and Moderna. It can produce the adenovirus-based vaccines like the Johnson & Johnson or the Oxford AstraZeneca vaccine. Now, moving on. One of the great unsung heroes of this pandemic is Mr. David Davis MP, who has tirelessly examined the evidence, taken expert opinion, presented in intelligible format. So he's taken the vitamin D efficacy data and he's translated it into a form that even MPs can understand. and that is a major achievement. He's done a fantastic job, and he did this brilliant speech in Parliament. If you have time today, click on that link, listen to it. I actually found it quite emotional listening and hearing him say that. So, for example, in Andalusia, southern province in Spain, 8 million people, death rates cut by 2/3. They were 50 to 70 deaths per day, now down to 5 to 15 per day, because they're giving calcifidiol to high-risk groups, the groups that are most likely to die. So they've cut the death rate. Is that proof that vitamin D works? No. Is it a massively strong correlation? Yes. And he also we've talked about before, what's called the Bradford Hill criteria, where we can adjudicate how likely a correlation is to indicate causality. We might do that again sometime, but we have done it before on this podcast. Very impressive work. It's currently being reviewed by the authorities in Madrid, and I really hope that the authorities in the UK, who've been remarkably disappointing on this, are going to review that Spanish data. If they don't, I would consider them negligent. Let's hope that they do. India, moving on to India, emergency approval of 2 vaccines. They're going to give 300 million doses pretty soon, really pretty soon. 300,000 vaccination centres, that's going to double pretty soon. Be 6,000 before long. Oxford AstraZeneca vaccine, produced in the Serum Institute in India in Pune, which I believe is currently the world's largest vaccine producing facility, until this Oxfordshire facility takes over, I believe. So no ambiguity there. Oxford vaccine, we know it works, we know it's as safe as acceptably safe. Well, to all intents and purposes, it's safe. Nothing is ever 100% safe. My mum had it 2 days ago. I was delighted. I am looking forward to having it. Not that I'll get a choice, or we'll just be given one anyway. But also in India, they're rolling out this Covaxin, made by this Bharat Biotech pharmaceutical firm in India. Now, this is rather bizarre, because for this second vaccine, so this one's absolutely beautiful. We know we've got all the data on that. This one we simply don't know. I mean, I am really somewhat taken aback by what the Indians have done here. The phase 3 clinical trial data is not yet out, yet they're doing a mass rollout of this vaccine. Now, we talked about this happening in China, we talked about this happening in Russia. It is not the way we do it in Western countries, yet it is happening in India on a scale that we can't imagine for the 1.3 population of India. So quite what is happening, weird, don't know. We assume that the Indian authorities have got pretty good reason to believe in its efficacy and its safety, but we simply don't know. There's nothing published on it. Anyway, both transported at fridge temperatures, both cost 2.75 United States dollars. Let me just say how much they each cost. They each cost $2.75 each. That's how it can be done. Now, this article I've looked at, this is from the Washington Post. The Pfizer's about $19.50 now. I think the Moderna's quite a bit more expensive, but this is $2.75 per dose. And this is about the same price as the UK is paying for the Oxford vaccine as well. Like under $3 US dollars per dose. How much does it cost to save a life? Answer, under $3 US dollars. But of course, the Oxford AstraZeneca vaccine have agreed not to make any profit for the course of the pandemic, for which they have my unbounded admiration. Indian regulators, what they've said is that this untied vaccine is in clinical trial mode. Now, no one knows what the heck that means. What does it mean to give out? So they're giving out mass vaccines under clinical trial mode. That's the direct quote. That's what they've said. What does that mean? Never heard of it before. Don't think anyone ever has. So that's what they're doing. Let's hope that they collect the data quickly and the efficacy and the safety is demonstrated. But right now, we don't know. The Serum Institute in Pune is going to be very important for the COVAX project to vaccinate many people in poor parts of the world, because they are producing doses at $3 per shot. Now, Israel Rate of community transmission remains high in Israel, so we knew they had that wave. It went up, went down, and now it's still up. And this is despite 20% of the population being vaccinated. So when 20% of the population is vaccinated, cases can still go up. The reason I put this in was the herd immunity effect has not yet kicked in. Well, maybe it has, but it's still going up dramatically. So the point I'm making here is people that are vaccinated must follow exactly the same precautions as everyone else. 100% they must. Pfizer-BioNTech reduces chance of catching coronavirus by 33 to 60% after 14 days, according to preliminary Israeli data. Now, one study has shown 33%, another study shows 60%, so we don't know yet. But anyway, we can say looking like vaccines prevent recipients transmitting coronavirus. Actually, no, that doesn't follow from that, but this is also what's been said. So it looks like there's data emerging. It's not there yet. It's emerging that there's going to be less transmission with people that have had one dose. So what we're saying is if someone's had one dose, that reduces their chance of catching the infection by 33 to 60%. But we believe from other data we've looked at with the Pfizer vaccine, one dose reduces the likelihood of hospitalisation by 90%. And as far as we know, the Oxford vaccine reduces the chances of hospitalisation by 100% from the phase 3 data. But now Israeli studies are tentatively saying it looks like the vaccine prevents recipients from being transmissible as well. So that's encouraging, but we can't say more because we don't have data on it yet, but it's looking encouraging. Now, they're still crunching the numbers on this, but what the Israelis have done is they've taken a group of 200,000 who've been vaccinated, a group of 200,000 who've not been vaccinated, and they're comparing the two, which gives an absolutely fantastic controlled study on very large numbers. So more data to flow from that soon. I'm expecting the quality of data from Israel to be superb because of the quality of the analysis that they're doing, and I expect that to have applicability on all vaccine programs around the world as they forge ahead as being the country with the highest number of people vaccinated per capita. Important to stress, everyone must behave completely as normal. Full 95% protection comes after 2 shots, of course, but we believe 90% protection against being hospitalised after 1 dose. Sorry, gone on a bit today. I'll do Zimbabwe and Australia quickly. Israel inviting over 50s. Zimbabwe, what the heck is going on in the Zimbabwean government? I mean, dear me. The government will first ascertain that COVID-19 vaccines are safe before administering them on volunteers. Now, I'm sorry, I thought that's what the phase 3 clinical trials were for, that we published on here a few weeks ago now. What's going on there? They say they're following other states with keen interest to learn from them. And Zimbabwe's adopted a measured approach. In other words, so far they haven't vaccinated anyone as far as I know. A measured approach, it looks like they're sitting back on their hands doing nothing. So, don't know what the thinking of the Zimbabwean government there is, but nothing's happening and they are finding out if things are safe when they've already been demonstrated to be safe. Further, in the unlikely scenario that cases spiral out of control, all hospitals in the country may be turned into COVID-19 centres. So they're talking about this contingency plan that all hospitals might need to be turned into COVID-19 centres, but they're not starting any kind of vaccination programme. Doesn't make sense, does it? But that's what the Zimbabwean government is saying. At least that's from the Zimbabwean press. And I'll put the link on there for that. Now, finally, you'll be pleased to hear, Australia. Now, as we said a few days ago, people, tennis players, travelling to Australia for this tennis tournament, Australian Open, I think. As we said, infections can take place on planes. We said that several days ago. Guess what's happened? People have come off the planes and proved to be infected. Well, imagine that. It's a pandemic. People are infected in a pandemic. How strange. And several players have expressed frustration. At least 3 female players said they might not have gone if they'd known they had to quarantine in the hotel room for 14 days. Well, in the playground, we used to say, "Dear Dumsy Poo." What part of the world pandemic don't these people understand? You fly around the world in a metal tube. Okay, it's got filters and things on, but if there's infected people on the plane, of course you're going to have to quarantine for the full 14 days after. This is why Australia has no cases. And these poor dears are complaining about it now. I mean, to be fair, isolation's not for important people, is it? It's not for the elite. It's just for the hoi polloi like you and me. It really, you sense my annoyance. They've got the tenacity to complain about it. It's just unbelievable. Anyway, at least 47 players are now in isolation, as we anticipated on this channel a few days ago. 2 flights with positive cases. Therefore, everyone on the flight, of course, has to self-isolate, which, of course, is why Australia's got no community transmission. And we did express our fears about this because of this. People flying around the world in a pandemic from infected areas to Australia, which is an essentially non-infected area. Now, Emma Casser, Quarantine Commissioner Victoria, people in the hotels were breaching lockdown rules by opening their doors to communicate with others on their floor. So not only some of these people that have flown into Australia, not only have they flown to Australia, not even obeying the rules of the Australian government. When you go to a country, you obey the laws of that country. If I go to another country, I go out of my way to make sure I'm obeying the laws of the other country in terms of traffic regulations, for example. You might sometimes forget and do something, react to, as if you're in your home country, but you go out of your way to try and obey the laws as much as possible. We have that saying in English, don't we? When in Rome, do as the Romans do. But you certainly obey the laws, even if you don't want to obey the cultural aspects. So this is very disappointing. This is very disappointing. And she says it's really low level but really dangerous acts, which we just can't tolerate. I agree, Quarantine Commissioner, 100% with you and would support you. But anyway, we've flagged up a few things on this channel that have been ignored. That's just one more. And that's quite enough for today. So thank you for being with us, of course, as always. And the next few weeks, we have to be 100% rigorous in our protection measures, because in the UK, the health service is going to be, it's going to have its busiest period ever in the next few weeks. But then the current measures and the vaccines will kick in and things are going to be great in summer. Way, way better. Spring, summer. This vaccination programme is the rescue. It is the ticket out of this pandemic. And we've seen, although frustratingly slow, we've seen signs of great encouragement. Thank you for watching.